everyone. I'm Craig Martin, CEO of Global Genes, and I'm going to be the moderator today for an educational session on the foundations of organizational planning for nonprofits, which I think is sometimes an underappreciated area of expertise for organizations, but one that you overlook at your own peril. And I've got some great panelists today. Katie Stevens, who's the Executive Director of Team Telomere, and Dan Billingsley, who's from the Global Foundation for Paroxysmal Disorders, both of whom have some great words of wisdom to share and are going to be available for some lively question and answers. I'm going to start it off by asking Katie and Dan to introduce themselves and share a little bit about their journey with you, and then we'll dive right in.
Okay.
Katie.
Hi. Thanks, everyone. My name is Katie Stevens. I'm the Executive Director of Team Telomere, like Craig said. My journey into advocacy started almost 9 years ago next week when my little boy was diagnosed with aplastic anemia. At the time, it was considered idiopathic. Aplastic anemia is a rare bone marrow failure, and we took it a step further into the rare world and found through later testing that his bone marrow failure was caused from shortened telomeres. My commitment to him was always there as his mother, but I'll never forget the first night going from the emergency room onto the oncology floor and having a little boy look at me and say, "Can you sleep with me tonight? I'm scared." It still lives in my body like that is today. Riley underwent an experimental bone marrow transplant in Boston, Massachusetts. I live in northern Idaho. Separated my family for 6 months to see that through. And Riley's 6 years post bone marrow transplant, doing really well. He's a river guide in the central Idaho Salmon River. And I have the fortune to be able to know the disease, but not have to be an on-hands caregiver any longer. And I get to be a caregiver for the community. I went from being a board of director to the president sort of in an overnight transition. And now I'm the executive director, our first, and I am also a director on the board of directors for Global Genes and Foundation Alliance member. I love the rare disease community. I feel like there's no community like it. It's not one you want to be a part of necessarily, but how fortunate that we have this kind of community to lean on through our hardest times. I remember meeting Kendall Davis, who worked for Global Genes at the time, and Kendall's gave me some advice, and she said, "You may never be breast cancer, but you might be cystic fibrosis," meaning I had some context to look at. Maybe we won't be that big, but we will be that impactful. And Kendall now serves as Team Telomere's board of director president. And so I just feel like our journey together and her advice has really helped our organization grow. So I'm grateful to be here. Thank you, guys.
Thank you, Katie. Dan.
Well, good afternoon, everybody. My name is Dan Billingsley, and I have a 23-year career working in nonprofit management, particularly in the areas of fundraising, marketing, and public policy and advocacy. For the last 10 years, I have worked for the Oklahoma Center for Nonprofits, which is a statewide nonprofit association. And I'm going to talk a little bit about the resources available possibly in your states through those state nonprofit associations. I have a long background in both arts administration. I actually went to school to be an opera singer. And then went back to school to do marketing work. But I also worked for a long time in the mental health and substance abuse world and did a lot of work in mental health advocacy and still continue to do that work today. My introduction into rare diseases was in 2016 when a young woman called me on the phone, and her name was Melissa Bryce Gamble, and she was here in Tulsa, Oklahoma, and she said, I really need some help. She said, I don't know what I've gotten into, but I started a nonprofit and I've got a great board, but we've got a lot of work to do. And so I actually met her at her attorney's office. I was there to meet with the same woman about something else. And the two of us hit it off right away. And I got to start working with the Global Foundation for Paroxysmal Disorders, which is based in Tulsa, but a global organization. And the work that I did with them began as just helping them with some board governance issues, but then that led into strategic planning. It led into board development, development of policies and procedures. But one of the things I'm going to say is that Melissa, when it came to running a nonprofit, especially a new nonprofit, in the state of Oklahoma, I will tell you, Melissa was one of our top 5 stars. She took everything very seriously. And we're going to talk today a lot about something called the Standards for Excellence for nonprofits. And I'm going to talk a lot about, why nonprofits need to adopt best practices, and that when you do, your nonprofit is going to thrive instead of having to survive. And I want to say that 5 years later, a window of opportunity opened up for both of us. And I am now doing much more embedded consultation and advising work with the GFPD. And she's got me for a long time. And I can't wait to continue this work as we launch into really the next big phase of this organization. What I will say is that in 2016, she started with a totally working board, a small budget, and just 4 weeks ago, we had a fundraiser and raised more than $100,000 in one night, and the average age of the donor was 38. Which is unheard of really in the philanthropy world. So we'll talk a little bit about why that was successful. And the one thing I will say is that I am available through the GFPD to any organization out there if you need advice, if you need help. But again, I'm going to be giving you some resources, and I will certainly leave some more information with Craig and Katie and everybody at Global Genes so that you have that available to you. So thanks, Craig. Thanks, Katie.
Right. Thank you, Dan. So I think let's start off with Katie. Just got some information and guidance to share, and then Dan does as well, and then we'll launch into some Q&A.
Okay. I'll get started because I know our time is limited. I just am really grateful. I'm going to learn along with you guys. We started off 15 years ago, really grassroots. Small group of families had joined at the National Institutes of Health. It was more about outreach at the time, finding community, finding someone who you could find camaraderie in. And as the years went on, research became more and more important. We started realizing, and this was prior to my time, so I definitely came in with a foundation built there. Research was important because we started realizing that we knew more than most of the physicians, which I think everybody in the rare disease community can relate to. And then when we decided that we couldn't do one or the other, which is exactly why I was asked to speak, is our small nonprofit does outreach and research and builds our circle of advocacy on those two platforms. We started to really be able to capture more of our community. Some people wanted that outreach. Some people wanted that very connected community. And some people just wanted the research funded and just wanted to see this disease cured, which we are a long way from. So I came in and the board of directors had already sat down with Bruce Friedman, who many of the nonprofits have in the rare disease community have worked with, and they had created a strategic plan. I actually just told Craig and Dan this. I am a more tactical human being. I tend to do better. If you give me a plan, I can see it all the way through. And I cannot emphasize enough to develop and take the time to, one, survey your community and take it back to your mission, which the mission should capture your values, your plans, where you see yourselves in the next 5, 10, 15, 20 years and keep coming back to it. I hold tight because we, like I said, I came in later. I wasn't a foundational member of this organization. We hold tight to the values of the beginning founders and remind ourselves all the time of how do we integrate that into our next steps. Go back to the patient voice when you survey your community. And I'm just going to take a second because I am so nervous. I can't believe how nervous I am on Zoom versus the stage. But I want to reiterate to any small nonprofits that are out there that are just starting or scrambling, I am with you. I am learning as I go. We do best practices. We look at board source. We look at all of the things that I'm hoping that Dan has put some things together so I can learn through him as well. But mine is from a smaller version of that, where we are creating trust with our community at the start, and then you can grow from there. So some things that we have looked at is when we talk about fundraising, when we talk about what does it mean to fund research? What does it mean to create programs that create outreach? What does it mean to the families that are going to be donating? What does it mean to the families that are going to be receiving? And so surveying our community and creating this circle of trust where we were constantly communicating through social media, through newsletters, we started to see we could bring that all back to the mission. Does the mission still hold those values, or is that something we needed to grow? And we, through that practice, have found and published papers that was research based on what the community was feeling at the time and where they needed research to go. As we developed, or as I had the strategic plan, we had a plan laid out in front of us, and we could create trust with people that wanted to get on the board and be a part of a board that had some form of a plan in front of them. I think that as we build an organization, if we just kind of go, well, I don't know, and we don't have proper practices. One piece of feedback I received was we had a great woman from Oklahoma. She worked with the government in Oklahoma, but we didn't have an onboarding plan at the time. And so when we weren't able to do the onboarding, we lost a member because we didn't have that. Hi, I'm homeschooling. We didn't have that in place. And so when we have that plan in place, we could build trust to keep people. When we finished the strategic plan, or what we thought was finished, our 5-year plan, we were able to go from a fully working board to a committee-run organization. The pandemic hit us. It actually almost fell at the exact moment we finished with that first 5-year plan. Our board president has created what we call a living strategy at this moment in time, where we go the next 6 to 12 months. We've had to cancel, pivot, and rethink just about every single piece of our organization's programming for the last 2 years. And I don't foresee, I feel like we're getting to where we're going to see each other again, but we'll see. In that time, we had our greatest fundraising year ever. And I feel like that was seeing a strategic plan all the way through, building that trust with the community, coming back to the community, and seeing it all come to fruition, even through a pandemic. We were able to create proper onboarding and offboarding, which created critical commitment for our board of directors. We were able to, through sort of you have to have proper representation. We were able to do what we call the rule of 3 in our board. We have a third of our board needs to be directly impacted in the community. They either need to be, and typically what we're finding is the bereaved community comes back to us quite a bit to serve. And that's a really special and it's really special to be able to take that love that they have and give it back to the community in that way. We have a third of our board is in the research, and a third of our board is completely outside of the community, completely outside of research, and has critical needs that we need met on the board of directors. And then I would just say include. Have your diversity statement created and take advantage of that, and then build your platforms going forward. We had a really interesting year where we're still learning about our needs in the community with diversity and equity and inclusion, and how far we have to go in that. So that's actually one of the sessions I look forward to in this as well, is how to use diversity, equity, and inclusion to build your mission and to build your strategic plans or living strategies, as we're calling it right now. This was part of our vision. I'm happy to share this slide. I know my time's running short, but engagement with our communities, making sure we have a care package program, which I know Global Genes has heard me talk about before. This has become even more crucial through the pandemic, bringing community directly to the families, bringing the clinical guidelines directly to the families. We are trying to we have Family Days program, which helps us to, again, build that trust. And then support for patients and families. We helped the National Institute of Health launch a caregiver study so that we could find the gaps in caregiver support. And that helped us better understand how we move forward in our strategy as well. We are missing a whole sector of the caregivers, and we really feel like when the caregiver burns out, the care for the patient declines. And so we just try to bring that all back to that mission, and hopefully, as the years go on, we believe that when building the strategy and the individual voice is heard, the mission becomes a plan that changes lives. And this is my dear friend Gabe, who, with a lot of help, got a liver transplant that he needed. This was a need that was never met in our community before. And he is a thriving young man now. And I believe that all comes from developing an organization that not just the community trusts, research trusts, and our donors trust as well, to create a reciprocal relationship. So thank you.
Thanks, Katie. Dan.
All right. So good afternoon. I just want to say what Katie just told you, I am going to amplify quite a bit. And there was one word that Katie used that I want to start with, and that is the word trust. The nonprofit world, and I just, I'm going to get very technical here on the nonprofit. Many of you hear technicalities scientifically. I'm going to give you some very technical business terminology. The nonprofit sector is really wide. It is the 501c sector. Nonprofit simply means that we do not pay corporate income taxes. In many states, we also do not pay ad valorem taxes. In some states, you don't pay sales taxes. However, just because we are a nonprofit, I want you to start thinking about the term tax-exempt organization rather than nonprofit, because one of the things that we have to get out of our minds is that we need to live in a land of scarcity. If we are a nonprofit organization, a tax-exempt organization, that does not mean that we should be living hand to mouth and living in scarcity. And so in order to make the money for our mission, and you will hear this time and time again, it's a little crass, but any nonprofit consultant will tell you, no money, no mission. You can have all the heart, you can have all the love, you can have all the time and the talent, but if you do not have the treasure to put into that, you will not have a successful mission. So when we're thinking about organizational development, we have got to put money on the table. And it's not a fun topic to talk about. But the only way we can put money on the table is through the concept of trust. And when Katie talks about trust and building trust in the community, building trust among the people that you serve, building trust among your donors, this is the most important thing that we can be considering as we're talking about developing our organizations. We've got to build trust. And in order to do that, we've really got to embrace best practices. And so I'm going to go through a few slides quickly about really the organizational development that you need to build that trust. So I'm going to go ahead and start talking about the foundation of your organization. And the foundation is you can't go out and raise money if you haven't developed your mission and your programs. So your mission statement has to be defined. And a lot of organizations think that they have a really defined mission, but in many respects, they don't know exactly what they're going to do. And I'm going to tell you a funny story. A man and a woman came into my office about 9 years ago. And I got to tell you, the guy looked just like Santa Claus. I mean, when he walked in, I thought, this guy looks like Santa Claus. Their organization was called 21st Century Santa. And their whole organization was that he and his wife would dress up as Santa and Mrs. Claus and do beautiful things for children. The problem was, and we went through 3 different strategic planning sessions and mission sessions, they never could define their real mission. They never really knew what they wanted to do, other than raise a lot of money and do good things for children, but they never could define that mission. And so one of the things that we've got to do is make sure we have a very well-defined mission, and that is accepted and really purposeful through our board of directors. The other thing we've got to do is create a vision. What is our vision? What's our vision? As Katie said, we had to look at what are we going to be a year from now, 5 years from now, 20 years from now? What is the vision of your organization? Is it to find a cure? Is it to change the trajectory for families? Is it simply to provide supports? Is it to provide advocacy? What is the vision that you have? And define that, especially among your board of directors, because that is what is going to guide you. And Katie talked a lot about strategic planning. I am a big fan of strategic plans. What I am going to tell you is that post-pandemic, and I'm working on 2 organizational strategic plans right now, we are not thinking any further than 2 to 3 years ahead. We are going to get through the next 2 to 3 years, and then we're going to regroup. And as Katie said, having a living strategic plan right now, I think is the smartest thing you can do for an organization. Looking at that every single board meeting, every single staff meeting, that you're sitting down and saying, what is our strategy going forward, and where are we going with this? The other thing you've got to do is outline your programs. What are your programs going to be? With the GFPD, I have to say that they had a really good idea and definition for their programs, and they really fall under 3 pillars. The first is going to be support. And that pillar of support is going to be supporting families from the initial diagnosis, which can be shocking and damaging to a family, through the treatment process, and through, for what many of these children go through, inevitable death and grief. And so providing those supports is crucial to make sure that the families, one of the outcomes is you want the families to stay intact, because many of these families also have non-affected children. They have non-affected adults. And we want to make sure that the family is supported in a way that is going to be as healthy as possible for everybody involved in that, including the patient. So supporting the caregivers, that's a big pillar. The second pillar is really about informing and convening. And so we have to spend a lot of time informing through education. This is going to be through medical education. This is going to be through support education, linkage to services, convening, bringing people together to talk. One of the things about the GFPD is that they host a conference every year, and we're going to be hosting one in June in North Carolina. We're going to be announcing that next week. But that convention is more than just a gathering of families. It's a gathering of scientists. It's a gathering of medical professionals, of care professionals. It's so that people can share. It's that people can support one another, feel. So that learning and convening, that pillar is so important in the work that we do. But the third pillar is advocacy. We have to advocate for change. Think about this. 35 years ago, if you were sitting in an office, all of you would have had an ashtray in front of you. Remember, people actually smoked in the office. 35 years ago, many of us were not wearing seatbelts. It was because of nonprofits. Nonprofit organizations like the American Heart Association, Lung Association, Medical Association, who stood up against a huge tobacco industry and completely changed the landscape for the United States, particularly, and around the world, saving lives, changing lives. And this took advocacy work. This took policy change. This took people taking enormous risks, putting their livelihoods on the line to advocate for change. The same happened with seatbelts. You can look at all sorts of movements. There's a great book, Forces for Good. I really want you to take a look at that at some time to understand that movements take action and advocacy takes a lot of work. So the third pillar is really around advocacy. So that's for scientific community, medical community. Remember, even our caregivers and care providers are not always educated in the work of rare diseases. You can walk into any general practitioner's office, and if you start talking about a rare disease, a lot of times those individuals may have heard of it only once or twice in medical school or nursing school, and they're going to require education. And so we have to be the best advocates that we can be for patients, et cetera. Then we've got to define impact and outcomes. What are the outcomes we want to see? Is it behavioral change? Is it societal change? Is it policy change? Is it just making sure that families who are grieving have the supports necessary so they can grieve with dignity? So think about that and define your impact and your outcomes. And then finally, that strategic plan. And I will say that if any of you want even an hour and a half Zoom call just on strategic planning, I would be happy to do it. So Craig, let everybody know if they want to convene something, because I would love to bring Melissa on and really talk through our strategic plan and the goals that we had and what we set. What I will tell you is that the strategic planning model that I use now, I call the ARC model, and it is about aspirations, results, and conditions. All of us have aspirations for our organization. And they can be huge, big, audacious goals. But the fact is, if we don't define the results that we're looking for, and if we don't set the conditions to make those results possible, those aspirations never become anything more than dreams. So when you walk through your strategic plan, just say to yourself, this is an aspiration, but what are the results we want to see? You've heard about SMART goals: specific, measurable, attainable, realistic, and time-based. That's what we're talking about when we're measuring results. And then finally, conditions is really about what are the conditions that we have to set. We all have been living through this pandemic, and the nonprofits that thrived understood that the conditions that they could control, that they had to take better control of. And that's why they did well. And organizations who didn't do that did not fare as well during this pandemic. What I will say is early on, over 1 million jobs, 10% of the nonprofit workforce was lost at the beginning of the pandemic. We've picked up most of that now. But what I will tell you is in Oklahoma, we only lost 1.2% of our nonprofit workforce. And the reason why, the organizations were ready, they worked hard, they were well prepared, they had a strong support network of other nonprofits and state association of nonprofits. And we were able to weather this storm a lot better than many other states were, simply because we had the supports necessary. Leadership is also huge. So, you've heard from Katie. Passionate leadership has to be at the forefront of your organization. But on top of passionate leadership, you've got to have competent leadership. And the one thing I will say about Melissa Bryce Campbell, the people that I've worked with her organization and with so many other nonprofits, is when the leadership is competent, and that is the executive leadership, whether it's paid or it's on the board, your organization is going to thrive. But if you are not cultivating leadership, then what happens is we enter a vacuum of leadership, and everybody is trying to scramble to do something. And when we don't have leadership, we're not going to have a really good initiative. We also have to have an exceptional board of directors. And another thing that we can always talk about at a future date is best practices for board of directors. Katie mentioned an organization called BoardSource. If you go to boardsource.org, and by the way, I'm going to put a few of these in the chat so that we can get these out to everybody. BoardSource is a really effective resource that you can go online. A lot of their stuff is free, and that will help you build the best board possible. Also, make sure that leadership knows their duties. We have legal duties as board members. That's care, loyalty, obedience, and transparency. But we've also got those day-to-day duties. Who's going to open the mail? Who's going to make the deposits? Who's going to ask for money? Who's going to write the thank you note? Make sure that everybody knows their duties. The final thing is, under this leadership, we've got to have policies and procedures to support our leadership. That means good bylaws, making sure we're following those, or we're taking care of one another. Because if your board is fighting, then you're taking away a chance to promote your mission. All right. So good, effective boards are going to work together. And that doesn't mean there's not going to be conflict. It's just going to mean that we're going to work together to get through that conflict. The next thing that we've got to have, and this is really our third pillar, is an operating framework. And what I'm just going to say here is policies, 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 procedures, procedures, procedures. When in doubt, write it out. I always say that. So if you've got a policy about something, write it out. Make sure that the board is definitely behind that. The other thing is, make sure you're defining your credo. Credo is Latin for I believe, and for any of you who are Catholic or in the Christian sense, you might say an I believe statement during a service, but I believe in a secular way. I think it's important for your board to sit down and actually say, and take 15 minutes at a board meeting and say, start with the two words I believe and finish it out, and then share that. Because this is a way to get board members to really get into their why. And many of you have seen that book, Start With Why by Simon Sinek. And I always say, if you don't have a why, you don't have a purpose. All right. The other thing you've got to have is a strong code of ethics. And all of us need ethical guidelines to stand by. And I will say medical ethics, and right now I'm in a doctoral program for community health and development. Medical ethics are really, really challenging. So you've got to really work through all of those ethical considerations at your organization and make sure and have those conversations, put them out there. As we like to call it, it's running the traps. And you've got to know, who are we going to be loyal to? Why are we going to do it this way, et cetera? Because ethics are all of that gray area between right and wrong. And so, too often we get into what's right or what's wrong when in fact we really need to be focused on the gray area. Legal issues, financial policies, personnel policies, volunteer policies, you've got to have them all. Katie mentioned diversity, equity, inclusion. I cannot stress this enough. I was in a seminar this summer and we read 24 books. Eight of the books were about health disparities. So if you are Black, if you are brown, if you are Asian American, Pacific Islander, if you are LGBTQ, if you are of a lower socioeconomic area, your zip code may define a lot more than your genetic code. And so understanding health disparities and understanding diversity, equity, inclusion, and why that's so important, understanding things like sickle cell disease and why does it affect Black individuals and not as many white individuals. I have a friend who's a researcher for Alzheimer's, and you would be shocked at the disparities between the Black community and the white community. So really understanding that diversity, equity, inclusion, and making sure that that is a pillar of your organization. It's not just a nice to have, it is a must have. So if there's a diversity, equity, and inclusion, any type of seminar you can do, make sure you take it. We're all learning. We're all trying to get better at it. I am a white middle-aged guy, and I have to work every day to make sure and fight some of those internal biases because we grew up with them. And so it's important to recognize them and react to them appropriately, and also ensure that your organization is doing the same thing. IT and social media. So this is a fun little area to talk about. All of us have social media accounts, and all of us have seen all kinds of social media snafus, but this is why you need to talk about with your board and say, hey, if you're going to post about our organization, could you also make sure you're not posting, trolly comments, because we don't want to get, stuck with you and somebody saying something. So, and I know that some of us may chuckle about this, but I've seen organizations really implode because of a board member or leader's bad social media behavior. Also, emergency plans, succession plans. We live in Oklahoma, and I'm going to tell you, fire, flood, and tornado. Every one of us has a plan for that. None of us had a plan for a pandemic, and we had to jump right into it. So make sure that you've got emergency plans, and those are well laid out, and everybody knows those. So succession planning is another thing that we could do an entire talk about. And I want to say, as Katie said, it's onboarding those board members, but it's also offboarding. And make sure that you're taking care of those board members as they leave your board, because you want to keep them involved in some way, either as a donor, as an advocate, et cetera. So that's why those succession plans are so critical. And then the final thing is and I'll be really quick about this, promotion and philanthropy. When you're fundraising, make sure that you're doing it ethically. Make your dollars count. There's a 3-to-1 rule. So for every dollar that you spend on fundraising, make sure you're raising 3 for programs. Have policies, have a fundraising plan, have marketing plans, have an advocacy statement, advocacy plan, so that you have a sustainable future.
Great. Thank you, Dan. That was a lot of really good information. We'll share these slides, if that's all right with you all, with anyone who would like them. And Dan, you had volunteered to consult. This is not a community that's shy about tapping into resources, so you might find you get a few takers on that. Wanted to just spend the time we have left trying to get to some questions that folks had. One of the questions was really around board formation. And I know, Katie, you mentioned the sort of rule of threes that you've used. And Dan, I imagine you've probably also, tried to form boards in a way that is strategic and maybe aligned with the mission. Can you share just some quick thoughts on how to go about that?
Yeah,
I'll let you start.
Okay, sounds good. And thank you for putting in all that. That was great, Dan. I was actually gonna cheer and clap for your whole thing. So for us, it really started with a group of 3, and we had to build from there. It was really hard to get people onto the board. It was really hard to get people to stay on the board. We found that some people were feeling overwhelmed with time commitments. I think that for us, we really had to look at, okay, we really need help in development. We really need help in communication. We really need help in strategy. And so we started to identify what we really needed. And then we really needed our researchers to understand what advocacy is. So we started to ask in the research community who was interested, who really was interested in helping from the patient perspective. When we started to identify, we could do an ask versus a wait, and which we found really powerful was asking, and then people started noticing the group growing, and we went from 3 and now we have 35. We have 11 board members and 25 plus committee members, and I think it just created this. They could see it working, but it really did start with us identifying our crucial needs first.
And we did get a question, and Dan and Katie, maybe you could speak to this about how then do you identify board members, you get them involved. How do you keep them engaged? Especially if you want a really active board.
I'm going to throw in the number one most important thing you can do when you've got a new board member is orientation. You have got to have a solid orientation for your board. So, orientation can look like a lot of things. It can be very formal, where you get the whole board together and you do presentations. It could be informal, where you take somebody out to lunch. But if you are not doing an orientation with your board members and making sure that you're including your seasoned board members in that orientation, then what happens is people, when they join a board, if they feel lost, they're not going to be found very easily. So a strong orientation is really critical. The second piece is I always think it is good for board members to know if there is staff people, they need to know who the staff person is that they need to talk to. It should be the executive director typically, or maybe a development director if you're a large enough organization. If you don't have staff, then make sure that the board chair is in direct contact with any of those new board members. And the last thing I'm going to say is after their first year of service, take the person out and get their feedback. Make sure that they're asking, how is your first year? What more do you need from us? What do you need to learn? What you will find is that many board members walk in, even people who've served on several boards before, they will walk in very overwhelmed. And in a rare disease organization, just imagine the immense amount of knowledge that you have to put through. I mean, you've got scientific knowledge, medical knowledge, advocacy knowledge, programmatic, et cetera. And so making sure that your board members have that good orientation, that's going to set them up for success. So, I would really push for good orientation.
So that leads to another question that we had about sort of navigating and managing expectations when you have an all-volunteer board. And when on that board, like Katie, to your point, you might have people who are themselves rare patients or caregivers. How do you appropriately set and manage the expectations on their time and their input?
I think I would go back to Dan's on the onboarding, understanding before they commit how much they can commit to. It also took a lot of, ground level stuff is hard, and it's a lot of hours and it's a lot of hard work, but it's a lot of understanding that volunteer time is volunteer time. And we went from every month having Sunday meetings for 4 hours, like at a time on a family night, to quarterly board meetings, and diversifying into committee meetings that were, at an hour tops, really utilizing that. I think you keep people better when you utilize their time and don't waste it.
Yeah. And so we got just a couple minutes left. And we've spent, I think, a good amount of time on the sort of organizational side of things. We mentioned earlier the importance of mission and vision. And Dan, I think you mentioned the examples of like seatbelts and cigarettes. I think oftentimes, though, when you're dealing with a rare disease, there's a lot of unknowns. So how do you advise an organization to prioritize where they want to take action? How they can narrow their mission and vision in a way where they can be effective?
Well, one of the things I'm going to put on my advocacy hat right now, having done a lot of mental health advocacy. It is really important to use a combination of two factors. Number one is data and science, okay? But number two is testimony. People have to have a personal connection. When we create laws, they're not named, the Harvard blind controlled study of, XYZ law. They're called Megan's Law. And the reason why is it's very important to put a face with the issue that you're talking about. And I think particularly for the GFPD, one of the things that I think they've been incredibly successful at is to make sure that there's a face to the disease. And it's not just the science. But if you don't have the data and the science, you're not going to have the buy-in that you need. So you've got to have a really strong combination of both. And the last thing I'll say is, whenever we're talking about fundraising, advocacy, et cetera, we always talk about the head, the hands, and the heart. The mission has to hit the heart, but the mission also has to hit the head. And if you get people's hands involved, they're going to be a lot closer to that mission. So that's what I would say. And I'm sure Katie has some really fine closing words about that.
Yeah. I just think, Dan, you couldn't have said it better. It's so much, it's meeting so many of who is coming to your community. It's making sure that it's that trust word again for me. And best practice builds trust to me. If you have good policy, if you have something you can fall back on, even with a board member who may not agree with something the org's doing, you can go back to your policy always. Like to me, it's best practice is the best retention and the best onboarding and the best everything. You just, get your thoughts organized and be able to give people what they need.
Well, I wish we had a little bit more time. We still got some questions coming in, but really appreciate the two of you for your time and some great words of advice to folks. And as I mentioned earlier, we'll share the information from this. And I see Katie just shared how you can reach her. So again, thanks to everyone for being a part of this. A really active conversation. A lot of chat going on alongside. So you've definitely prompted some thinking. So I want to thank you both. Thank all who have tuned in for this, and enjoy the rest of the summit.
Yeah, thank you so much for having us.